Welcome to Healing at the Speed of Light. Every week we discuss how laser therapy is changing healthcare and how you can benefit. Now here is your host and founder of Laser Therapy Institute, Dr. Jason Rountree.
Hey, thanks for joining us again today on Healing at the Speed of Light, your weekly laser therapy podcast. My name is Dr. Jason Rountree, and I'm your host today. I apologize for being a couple days behind here. We like to have these come out on Mondays so that you have the whole week to catch up on your laser therapy information. This week got a little bit away from us because I had a few more hours I needed to spend in clinic seeing patients than I usually do, and it just kind of got away from me. But, a little bit of a reminder, I am a clinician. I use this stuff every day in practice, gratefully. And I love seeing patients. This week, I just kind of let it get away from me a little bit and had to see a few more. But we're back at it again, and specifically talking about laser therapy and cancer. Now, if you listen to the podcast, then the June 15th episode, episode 27, we talked about supportive care for cancer patients. So that was utilizing laser therapy to assist with some of the side effects of traditional cancer treatments. Now, if you've done some digging into laser therapy, you may have come across someone who said that you shouldn't use laser on a cancerous tumor. And you might have thought, why not? You might have come across somebody that said that laser could actually cause cancer. And you might have thought, why? I don't even understand that. So what I'd like to do today is go through a little bit about the mechanisms inside the cells that happen when you're using laser therapy, the mechanisms that go on inside cells that are cancerous, and how those might or might not relate. And to do this, we're going to go to a study. You know, it's my favorite thing to do. The study was published in 2018 in Photomedicine and Laser Surgery, and the title of the review is Photobiomodulation, or, as we often call it here, laser therapy, and cancer. What is the truth? So photobiomodulation and cancer, what is the truth? We're going to be referring back to that, but first let me talk a little bit about laser. Very, very basic. So laser therapy and light therapy, utilizing red and infrared light, can be used on tissues and cells to improve the cell's metabolism by interacting with a part of the cell called the mitochondria. The mitochondria are little energy factories inside your cells. That's where your cells get the majority of the energy that they burn off and need to have proper function. So laser therapy can actually speed up that process where your cells get more of that energy that they need to have better function. Laser therapy also helps with providing better blood supply to the areas that you're treating. It pushes more oxygen into those areas. Cells can replicate and divide faster because they are getting the fuel they need, which means you get tissue regeneration and cellular repair. Now, I've already mentioned cancer, so a couple of those things sound like, if we're talking about cancerous cells that don't have a control mechanism for their growth, would feeding those cells make them grow faster? And that is actually what this article is all about. As a matter of fact, I'll read you a quote. It says, because photobiomodulation or laser therapy was shown to stimulate the growth of cancer cells in cell culture studies and can also increase the aggressiveness of some cancer cells, some commentators have asserted that photobiomodulation may be contraindicated in clinical use in patients with cancer. Let's break down that quote. So, if we've shown that laser can stimulate the growth of cancer cells in cell culture, meaning that we've taken the cells out, we put them in a dish, we put the laser on them, and we saw them grow faster, but it can also increase the aggressiveness of certain cancer cells, that sounds like bad things, right? That sounds like we don't want to be utilizing laser on those cells. So for a very, very long time, a lot of people have said, we should just not use laser therapy, at least not directly on a cancerous tumor. So what these authors did is they said, okay, let's look at the evidence, though, all the evidence that's out there for using laser on patients with cancer, even using it right on the tumor sites. And then even beyond that, if we're utilizing laser for things like pain, inflammation, wound healing, some of the side effects of cancer treatment, well, what if somebody has an undiagnosed lesion, an undiagnosed cancerous condition, and we do laser? Would that stimulate that cancerous tumor to get worse? So these researchers said, look, we've got just three studies that have been done that show that utilizing laser on animal cancer cells makes it worse, on the whole body. So they could find 3 studies that showed increased tumor growth or increased tumor aggressiveness. But those 3 studies either used really severely high doses of light, or they used immunodeficient mice, which that's mice that have been genetically programmed to not have immune system functions to help suppress the tumor. Or they used only the visible red laser, which visible red can be just fine, but the infrared lasers weren't used at all. And they found that there was some level of increased growth or increased aggressiveness. But then they looked at the other side, and they saw a large body of research that has been done that shows beneficial effects of light therapy on cancer through one of 3 different effects. Either a direct effect, where you apply the laser directly to the tumor, a combination therapy effect, where again you're lasering the tumor directly, or an immune stimulation and regulation effect that can be applied on the tumor or around the tumor, even elsewhere on the body, potentially. So in the direct effect, you use laser with such a large dose on the tumor that you actually overdose the tumor cells and overpower those cells, and you can end up with some very good reduction in the cancer size and the tumor size. The combination therapy is a little more complicated in that you're using chemotherapy drugs to increase the killing of the cancer cells because you're sending them more signals to reduce cell growth. Now, healthy cells and cancer cells respond very differently to light, to red and infrared light therapy in particular, because healthy cells that get an ATP boost, a cellular energy boost, are more responsive to these signals that are propagated by chemotherapy. In other words, that makes the cancer cells more sensitive to these drug signals too. So you can improve the performance of the medication usage and make the cells respond better than they otherwise would. The third one that they said had good effects is the immune stimulation and regulation side. And that's where you use laser to drive a better natural immune response to the cancer, which doing laser on and around the cancer site, they have said, does lead to increased recruitment of immune system cells, which immune system cells are very important for helping to fight and destroy cancer cells. Also increases reactive oxygen species and inflammation. Inflammation is actually the first step in healing, and it's an important part of controlling damage. Also, vessel normalization. So see, when a cancerous tumor forms, it will feed itself with lots and lots of new blood vessels around it. That way it gets more resources and can grow faster. But the researchers on this article said that laser therapy actually leads to a better normalization of the blood vessels in a cancerous tumor, meaning that it goes much more closely to how it is supposed to be. So again, to go back to our question, what if we have cancer, or what if I have an undiagnosed tumor? Maybe I don't know about it. Is if I get laser therapy for something totally unrelated and I have this undiagnosed tumor, is laser going to make the cancer worse? And the researchers say No, they say the more intriguing question is not merely whether laser therapy is safe and effective in cancer patients, but whether it can actually play an active role in cancer treatment. So not worried so much about if somebody has cancer and making it worse, but how could we use laser even to help the process? They say now is perhaps the time to lose the fear of exacerbating cancer by shining light on it. As a matter of fact, there's even potential that utilizing laser could help in reducing cancer. Now, this is still very early on. We don't have a good consensus on this. This article is 2 years old. We've had some more evidence come out that does support this, but it's still very unsettled as far as how physicians are approaching this. In general, we're still recommending that doctors don't directly treat cancerous tumors with laser, with the understanding that there's not really any real risk to worsening a tumor that's not diagnosed. So we're in this kind of weird transition zone where we think we're going to find more and more evidence that we can utilize laser to help reduce cancer tumors and help with cancer treatments. And especially the side effects of traditional cancer treatments. Again, I mentioned our June 15th podcast, episode 27, about supporting patients going through chemotherapy and radiation, things like that, by utilizing laser to help with some of the side effects. I think we're going to see more and more of that. Now, hopefully that helps you feel a little bit better if you've thought about this or heard about this stuff before, in terms of knowing that laser is not going to necessarily worsen a cancerous condition, especially one that maybe you're concerned. Maybe you're concerned that you might have an undiagnosed cancer hiding somewhere in the body. Are you going to get laser? Is it going to get worse? These researchers say really it's time to move on from that. And as we hopefully continue to learn more about laser therapy, perhaps in the near future we'll have even more tools to be able to fight against cancer. Thanks for listening in. I hope this was able to clear up some of your concerns if you had any. If you'd like to know more, please shoot us an email, info@lasertherapyinstitute.org. We'd love to be able to chat with you and be able to help you find the care you need. See you next week.
Subscribe to this weekly podcast for more great information. Find a certified laser therapy clinic near you at lasertherapyinstitute.org. If you're a healthcare provider, check out our practitioner-focused Laser Therapy Institute podcast. Thanks for listening.